Treg expression in steroid-free kidney transplant recipients.
Thank you, Mr. Chairman, for presenting me. I am Ahmed Yehia, nephrology consultant, urology and nephrology center, Mansoura University. Today, I will present my MD thesis entitled Assessment of CD4 positive cells, CD8 positive cells, and CD4 positive, CD25 high, CD127 low regulatory T cells expression among steroid-free kidney transplant recipients.
We can start.
Okay. Thank you, Mr. Chairman, for presenting me. So I'm Ahmed Yehia, nephrology consultant, urology and nephrology center, Mansoura University. Today I will present my MD thesis entitled Assessment of CD4 positive cells, CD8 positive cells, and CD4 positive, CD25 high, CD127 low regulatory T cells expression among steroid-free kidney transplant recipients. First of all, I wanted to dedicate this work to my late professors, Dr. Hussein Shaisha and Dr. Muhammad Adel Bakr, hoping them mercy and the highest degree of heaven. Immunologic tolerance achievement could be the rescue to improve the overall patient and graft survival among steroid-avoidance immunosuppressive kidney transplant recipients. The ultimate goal would be to identify an induction protocol to achieve allospecific tolerance as a standard of care for appropriate transplant recipient. Transplant tolerance has been defined as a maintenance of stable graft function in the absence of immunosuppressive therapy. Allo response is strong and self-amplifying, so when it's occurred, it's very difficult to be controlled. Several key immunologic findings led to the major effort to induce tolerance by ablation of the immature immune system to allow the establishment of chimerism by transfer of donor bone marrow or lymphoid cells. Regulatory T cells, Treg, play a key role in the generation and maintenance of immune tolerance. Tregs are defined as those allergic and hyper-responsive to stimulation of T cell receptor with suppressive action on the proliferation and activation of helper CD positive T cells and cytotoxic CD8 positive T cells via cell-to-cell contact. Regulatory T cells with their FOXP3 expressing marker are strongly suppressive of proliferation of effector T cells and memory T cells, thus controlling excess of immune response to foreign antigens and maintain self-tolerance. Best described marker in Tregs, CD25, which is an interleukin-2 receptor alpha chain that makes those CD4 positive T cells responsive to interleukin-2, a cytokine crucial for inducing T cell immune response. Another important study found that class 2 major histocompatibility expression is required to transfer tolerance. Accumulating clinical evidence strongly suggests that a favorable allograft outcome in human is frequently associated with a robust population of CD4 positive, CD25 positive regulatory T cells. The aim of this work was to assess the expression of regulatory T cells among kidney transplant recipients maintained on steroid-free immune suppressive regimen and its relation to incidence of rejection. To assess the relation of regulatory T cells, cytotoxic T cells, helper T cells to incidence of rejection, and assess risk factors associated with low expression of regulatory T cells. This study was held in Urology and Nephrology Center, Mansoura University, and included 100 kidney transplant recipients who received kidney transplantation in the duration between January 2013 and December 2017. The patients were divided into two groups according to the maintenance immune suppressive regimen. Group 1 study group, low immunologic risk kidney transplant recipients who received steroid-free regimen, 50 patients. Group 2 matched in age, sex, and date of transplantation, low immunologic risk kidney transplant recipients who received steroid-based regimen. Patients then were divided into another two groups. Group 1, kidney transplant recipients experienced rejection at any time point of follow-up after transplantation. Group 2, they was not exposed to rejection episodes. Exclusion criteria, non-Egyptian patients, lost follow-up patients, patients who were maintained on steroid-free protocol as a primary plan of immune suppression, but steroids were added later on at any time point. Regarding immune suppressive regimen used, tacrolimus MMF in the study group, the patient received 10 mg pulse steroid at day -1, day 0, and day 1, then 5 mg per kg at day 2, then 100 mg per day till tacrolimus trough level was above 5 nanogram per deciliter. Steroids then were stopped abruptly. Regarding steroid tacrolimus MMF, the patient received 10 milligram per kg pulse steroid at day -1 and day 0. Then steroids were tapered gradually to the lowest dose, 5 to 7.5 milligram per day at month 6. In both groups, tacrolimus starting dose was 0.1 milligram per kg. Target trough level in the first year was 5 to 10 nanogram per milliliter, then 4 to 8 nanogram per milliliter from the second year, and so on. 10 milliliter heparinized peripheral blood were collected from all patients, and after centrifugation, lymphocytes were separated, then tested for CD4, CD8, CD25, CD127, using the appropriate antibodies using flow cytometry technique. Transplant registry in Mansour Urology and Nephrology Center was reviewed for preoperative data, operative data, and post-operative data of all the participants, and data were tabulated in SPSS sheets, and then results were obtained. The results on comparison between steroid-free and steroid-based groups, baseline medical characteristics and demographics was comparable among both groups. Pre-transplant immunological workup was comparable. Delayed time to dialysis was delayed in 4 patients out of 50 in steroid-free group with a statistically significant difference. Total steroid dose in the first 3 months was significantly higher among steroid-free patients. Both groups were comparable regarding post-transplant medical complications and incidence of rejection. Follow-up serum creatinine over 5 years was comparable. Regarding CD4, CD8, and regulatory T cells expression, in the total cohort, there was strong positive correlation between regulatory T cells and CD4 expression. There was significant negative inverse correlation between regulatory T cells and CD8 expression. CD4 CD8 ratio is another marker for immune tolerance. Regulatory T cells was correlated positively with CD4 CD8 ratio in the total cohort. This is flow cytometry image show that direct correlation between regulatory T cells and the regulatory T cells in orange color and the CD4 in blue color to the right. Increased expression of regulatory T cells was associated with increased expression of CD4 cells. On the other hand, in this picture, there is inverse relation between regulatory T cells expression and CD8 positive cell expression. However, in both groups were comparable regarding CD4 expression, CD8 expression, and regulatory T cells expression. Analysis of CD4, CD8, and regulatory T cell expression regarding rejection. Flow cytometry images show low expression of CD8 cells in no rejection group. CD8 expression was highly significant among rejection group, but CD4 and the regulatory T cells were comparable in both groups. Blue cutoff value equal to 3.4% of regulatory T cells. Steroid avoidance affected negatively expression of regulatory T cells, and CD4 started to decrease significantly. Blue cutoff value equal to 2% of regulatory T cells. There was no difference between steroid-free and steroid-based regimen regarding the expression of regulatory T cells, but CD8 started to increase significantly. Summary and conclusion. In conclusion, regulatory T cells have an important role in maintaining a tolerance state after transplantation. Regulatory T cells play its role through down-regulating effector CD8 cells expression. On the other hand, increased expression of regulatory T cells is associated with increased CD4 positive cell expression. There was no statistical correlation between incidence of rejection and CD4 positive cell expression or regulatory T cell expression. CD8 positive cell expression could be considered as a marker for rejection, and there was statistically significant positive correlation between CD8 positive cell expression and the incidence of rejection. Regarding regulatory T cells, it could play a preventive role in rejection, not a marker for rejection. Outcome of kidney transplantation among steroid-free kidney transplant recipients is comparable to steroid-based kidney transplant recipient. Expression of regulatory T cells was comparable among both groups. Regular monitoring of regulatory T cells before transplantation and in time period after transplantation is needed to determine patient in whom minimization of immune suppression could be applied. Thanks. Any question?
شكرا.